A weak urine stream plus nighttime bathroom trips can tell you more than either symptom alone. But it cannot tell you what many men immediately conclude. It cannot measure the size of your prostate. It cannot prove that the prostate is the only cause, and it cannot tell you whether a supplement, medicine, or procedure is the right answer. What the pattern can do is move the prostate and urinary outlet higher on the list of things worth evaluating, especially when 3 additional clues appear with it. In this video, you will learn what the pairing suggests, what it cannot prove, and the exact information to collect before you make a decision. Weak can mean several things. The stream takes time to begin. It lacks force. It stops and starts. You have to strain. It dribbles at the end. Or you finish without feeling empty. Those are called voiding symptoms because they occur while the bladder is trying to empty. Nighttime urination is different. It describes waking from sleep to urinate. That event can involve urine production, bladder storage, sleep, the urinary outlet, or a mixture. When a weak stream and nocturia occur together, the outlet becomes more relevant. But relevance is not proof. Comment with the word that best describes your stream: slow, delayed, interrupted, or incomplete. That vocabulary is more useful than simply saying, "It is not like it used to be." The prostate sits around part of the urethra. As benign prostate enlargement develops, it can squeeze that passage. The bladder muscle then has to work harder to push urine through. The NIDDK lists trouble starting, weak or interrupted stream, dribbling, urgency, frequency, nocturia, and difficulty emptying among symptoms that can occur with benign prostate enlargement. So the combination is not meaningless. It is a legitimate reason to discuss the prostate and bladder outlet. But here is the counterintuitive part. Prostate size and symptom severity do not always move together. A slightly enlarged prostate may interfere with urination, while a larger prostate may cause few symptoms. That is why no one can look at the strength of a stream and accurately declare the size of the gland. And similar symptoms can occur with bladder problems, infection, prostatitis, urinary retention, medicines, and other conditions. The pattern opens a question. It does not close the case. First, incomplete emptying. If you finish and still feel full or need to return soon for a small amount, record it. Chronic urinary retention can develop gradually and may produce subtle symptoms. Second, change over time. A stream that has always been modest is different from one that clearly weakened over several months. Write down when you first noticed the change and whether it is still progressing. Third, amount at night. Large nighttime amounts suggest that urine production also belongs in the explanation. Small amounts with strong urgency keep storage in the picture. A weak stream can coexist with either pattern. This is why weak stream equals prostate is too simple. A man can have outlet symptoms and also produce too much urine at night or wake for reasons unrelated to the bladder. If these prostate-related signs sound familiar and you want to examine a nutritional prostate support option, I placed the full presentation in the description and pinned comment. It is marketed for prostate support. It is not being presented as proof of the cause or as a guaranteed way to improve flow or stop nighttime trips. The channel may receive a commission from a qualified purchase at no extra cost to you. Before deciding, there is a simple record that makes the pattern much clearer. For 3 days record, the time of every urination, day and night. The amount passed, measured when practical or estimated consistently. How long the stream took to start. Whether it was steady or interrupted. Whether you strained. Whether you felt empty afterward. Any urgency, burning, pain, leakage, fever, blood, or lower abdominal discomfort. Also, bring a complete list of medicines and supplements. Some medicines can contribute to urinary symptoms, but do not stop or change them without professional guidance. NICE recommends a frequency and volume chart as part of the initial assessment of bothersome lower urinary tract symptoms. The chart helps distinguish frequent small voids from higher nighttime production. That information prepares better questions. Do these symptoms suggest my bladder is not emptying well? Does the amount I pass at night suggest a production problem too? What evaluation would help distinguish prostate enlargement from other causes? Could any medicine or supplement be contributing or interacting? Subscribe if you want practical explanations for those questions without the usual fear and guesswork. Mixed patterns are another reason certainty is dangerous. A stream may be weakest at night but better during the day. It may change after a new medicine is introduced. Or it may be weak while every nighttime amount remains large, suggesting that outlet symptoms and nighttime production coexist. Use a decision ladder. First, rule out urgent signs. Second, ask whether the change is new, worsening, or affecting daily life. Third, use the record to see whether stream and emptying changes cluster. Only after those steps decide whether nutritional support is something you want to review. A prostate support product cannot determine why you wake, measure retained urine, review medications, or rule out another condition. That honest boundary makes the eventual decision clearer because you are no longer buying an answer to a question you have not described. It cannot tell you that you have cancer. It cannot tell you that you do not have cancer. It cannot tell you the exact amount of urine left in the bladder. It cannot tell you which treatment is appropriate. It cannot tell you that an over-the-counter product will work for you. Those conclusions require individual history, examination, and sometimes testing. There are also moments when the decision ladder becomes urgent. If you cannot urinate at all, especially with lower abdominal pain or swelling, seek urgent medical care. Blood in the urine, fever and chills with painful urgent urination, or severe urinary pain also deserve prompt attention. Do not use a supplement decision to delay those symptoms. Weak stream plus nighttime urination is not nothing. It makes the outlet and prostate more relevant than nighttime urination alone. But it is not a home diagnosis. The correct sequence is describe the stream, record the amount, notice emptying, mark the timeline, then discuss the cluster. If your pattern is non-urgent and you want to review the prostate support option mentioned earlier, the presentation is in the description and pinned comment. Read the label, review the manufacturer's claims and terms, and discuss it with a healthcare professional if you take medicines or manage a health condition. The strongest decision is not the fastest purchase. It is the one made after you know what the pattern can and cannot tell you. Share this video with someone who has been trying to diagnose his prostate from the strength of his stream alone.